Hi, I am Dr. Mamatha, pediatrician and neonatologist at Cloudnine Hospital, Sarjapur Road, Bangalore. So, what is exclusive breastfeeding? Exclusive breastfeeding is giving only breast milk to a baby up to 6 months of age. Following 6 months, babies are started on solid foods and breastfeeding is continued. So, usually mothers will have maternity leave for the first 6 months. So till then they will be directly breastfeeding the babies. But once they resume work, they need to express milk. How to go about it, how frequently to express at the workplace is usually it is at least every 2 to 3 hours once, and they can store the milk at their workplace. How to store this milk in the fridge? So if you are expressing and keeping it outside in room temperature, milk can be kept for up to 3 to 4 hours. If you are keeping it in the fridge, milk can be stored up to 3 days. And if you are keeping it in a deep freezer, you can store it for up to 6 to 12 months also. So next, coming to what are the do's and don'ts of storing breast milk. The first thing of do's is before mother leaves to work, it is better she breastfeeds the baby so that her breasts are empty and she gets some time before she starts working. Second thing is hygiene. Hygiene is very important. Mothers should wash their hands before pumping milk. Also, she should sterilize the breast pump and also bottles adequately before you pump into it. The other thing is, how do you store the breast milk? So you have to store it in a sealed container so that there is less chances of infection in the breast milk. And whenever you're storing in a container, please label it with the date and time so that you know till when you can use that milk. And always we recommend the breast milk to be kept at the back of the fridge on the racks rather than the door, and store it in small quantities. You get breast milk storage pouches and you can store in that so that it is easier also to use when you're not storing it in very large quantities. Now these are the do's. Now what are the don'ts of storage of breast milk is, you keep postponing because you're busy at work, you keep postponing expressing milk. So that can cause you a lot of pain. Then if you postpone a lot, there can be clogged ducts. Again, the clogged ducts will lead to infection and you will have fever, which is very painful for you. The other thing is, as I told earlier, keeping the milk in the door of the fridge is not recommended because when you open the door, the temperature of the fridge will drop and the milk, there is a repeatedly change in temperature in the milk, so which can also cause buildup of infection in the milk. So we do not recommend keeping the breast milk in the door of the fridge. And also how to mix the milk. Like, we do not want you to mix the warm milk and the cold milk. Like if the milk which a mother has expressed now, she cannot mix that with a milk which she's already kept in the fridge, which is cold. And once you have thawed the milk, you have removed the milk from a freezer and you have thawed it, made it liquid, you cannot refreeze it. Thawing of the milk is always in a hot water bath. Please do not use microwave to warm the milk.